Hello everyone, welcome to Satellite Pharmacy Clerkship. My name is Bala. I'm the lecturer in charge for this clerkship. Satellite Pharmacy Clerkship is an introductory practice experience and exposure to drug distribution system in the hospital setting. This clerkship will be conducted under my supervision. The main aim of this attachment is to expose the pharmacy students on the responsibilities, activities, and the role of hospital pharmacists in drug distribution and also drug therapy monitoring. There are several activities related to drug supply that a pharmacy student will be performing in the inpatient pharmacy setting. The student should make sure to identify and expose themselves with these roles and responsibility of pharmacists. For example, screening prescription and other documents, write and check cumulative medication record, dispense medication to inpatient via Unidose system, and other activities. I will bring you all through to each of these activities one by one in a systematic way. The role or activities of pharmacists in inpatient setting can actually be explained by looking at the medication management cycle. It is also known as medication management system. There are three main important activities that occurs in the medication management cycle. It is first the prescribing, secondly is dispensing, and the third is administration. Obviously, these main activities can be divided into smaller ones, as you can see in this slide. We as a pharmacist have a pivotal role in each of these steps in this comprehensive system. Providing the patient with an appropriate medication in an acceptable dosage form to facilitate easy administration has always been the role of pharmacists. As at different times in pharmacies' evolving responsibility, some of these activities seem to receive more attention. The role of the hospital pharmacist 50 years ago was primarily confined to the basement. This is what happens in the US and also in the UK. This location reflects the role of pharmacists had in the medication use cycle. The space was small and the personnel were few. The pharmacist's primary role was to purchase or prepare the desired drugs. The pharmacist prepared medications to be used on the nursing unit. The physician would prescribe the medication and the nurse would administer it to the patient. So what we do? The pharmacist rarely decided whether the therapy was appropriate for the patient or not. They would simply make sure that the nurse had a supply of medication for the patient. That's it. If this required repackaging or compounding of the medication, the pharmacy accepted the responsibility for this function, with the exception being IV admixture, which were usually prepared by the nurse on the nursing unit. There were at least two distinct distribution methods the pharmacy would utilize for the nurse to obtain the medications for patient use. One was referred to as the floor stock system, and the other was the patient prescription system. Floor stock system was the more common method used by pharmacy department long time ago. In fact, it is still being used now in our hospitals in Malaysia. In a sense, it was a duplication of a small pharmacy on the nursing unit where drugs were stored prior to the nurse preparing drugs to administer to patient. The pharmacist was responsible for stocking the nursing unit. The pharmacist would place bulk container of medicines on the unit, often called as the drug room. There were multiple doses in each bottle to supply all patients receiving the drug on the nursing unit. For example, there will be a bottle of aspirin, and every patient who are on aspirin in particular ward will be taken the drug from these particular bottles. The nurse was the professional responsible for preparing the patient's specific medications for both oral and intravenous use. The nurse will read the physician order, then they will go into the drug room to select the drug and prepare it, and then administer it to the patient. See, there is no pharmacy involved, right? In this selection process, the nurse could choose from many different medicines. If a medicine needed to be refilled or a patient was started on a different drug, the nurse would request the new medicine to be stocked on the nursing unit. The pharmacist would likely never see the physician order or prescription, but would stock the medication on the floor solely from the nursing request. This system was utilized because it required few pharmacy personnel. It was also assumed that this distribution system was safe until we identify a new system which they have new data to prove that is much more safer though. And of course, the disadvantage of flow stock system is medication errors. There are several types of medication error, for example, transcription error, administration, and poor communication between the healthcare providers. This can easily occur in the flow stock system. There are also other big problem in the flow stock system, which is overstocking. We can see that a lot of drug being stocked in the ward. This can cause the nurses or other personnel who are working in the ward to have a misappropriation of filtrage, which is mean that they can unauthorized removal of the drug. It's simply as stealing. Filtrage is the act of stealing small quantity of the drugs. And once there is overstocking of the drug in the ward, we can also cause obsolescence and also deterioration of the drug after being kept for long term in the ward. And sometimes some of these drugs can be expired. Now that you all know what is flow stock system, the advantages and also the disadvantages of flow stock system, now I would like to describe you all to the another distribution system which is called as patient prescription system. The patient prescription system involves the pharmacist to a greater extent by requiring a review of the patient order or prescription. After the physician wrote the prescription, the nurse would transcribe the medication order and send it to the pharmacy for preparation. We as a pharmacist would prepare a 2 to 5 day supply of medicine for the patient. Once the pharmacist gives a 2 to 5 day supply of medicine for the patient, the nurse would store the medicines on the nursing unit. This system still required the nurse to prepare the individual dose for the patients. When the drug needed to be refilled, the nurse would contact the pharmacist who would prepare it and send it to the floor for the continued use. When the drug was discontinued or the patient was discharged, the prescription bottles will be returned to the pharmacist. Even though the pharmacist had the opportunity to review the patient order, the pharmacy would place only limited judgment on whether it was correct or appropriate for the patient. This was because the pharmacist did not have access to the pertinent patient information and because it was not expected of them. The unit dose system is defined as a pharmacy coordinated method of dispensing and controlling medicines in healthcare institution, for example in hospital. This system is characterized by medications contained in unit dose packages, I will show you later, dispensed in ready to administer form, and not more than 24 hours supply being delivered or available on the patient care unit at any time. This is very different than the previous method that I was discussing earlier. The pharmacist dispenses patient-specific medications to be administered not prepared by the nurses anymore. This is an example of unidose system. Here you can see that 2 capsules of cloxacillin of each 250 mg were packed together in a unidose packages. It is ready to administer at the moment. It means that the patient only have to open the plastic and take the drugs together at one point. If the drug is given 4 times daily, then each time the patient will be given one of these ready to administer medicines. Remember this, the patient drug will be supplied only for 1 day. This is different from a flow stock system and also patient specific system that I told you earlier, where the drug will be supplied for 2 to 5 days. This is example of oral solution or oral liquid that can be given to the patient using unit dose system. In this example, syrup lactulose 10 ml is packed into a small bottles. For each time, the patient will take one bottle and drink the medicine. For example, here is syrup lactulose. Another example here is syrup KCl or potassium chloride. So it's easy for the patient to just open the bottles and drink. It's very hygienic. I will tell the advantages and also disadvantages of unidose system later. But before that, we have to know what other drug can be supplied by using unidose system. There are only several drugs can be supplied using unidose system. One of the very obvious example is tablet forms, capsule forms, and also blister packaging form. All these oral solids can be supplied using unidose system because it's easy for you to pack individually. And other is the oral liquids. I showed you an example earlier how that oral liquid can be packed in individual dosage form. It can be a solution, a suspension, or syrups, elixir, or also emulsion. Transdermal patches also can be supplied using unidose system. Other examples are suppository, pessary, and also ampules. Rather than knowing what other drug can be supplied in unidose system, I think it is important for all of you all know what are the drugs that cannot be supplied using unidose system. The most logic thing that you can give me, the answer that you can give me is inhalation, right? Aerosol, inhalers, and nebulizer cannot be supplied by using unidose system. Don't tell me that you can break inhaler into 3 or 4 types, what you call 3 or 4 parts, and then you want to supply to the patient. It's not logic, right? Others are cream, gel, ointment, lotion, and also paste. Drugs like eye drops, nasal drops, and sprays cannot be supplied using unidose system. We have to supply them once during the admission. Other example is radioactive pharmaceuticals. Don't tell me that you want to supply unidose system for radioactive. It's dangerous for you and also for the patient, right? Other drugs which are very hazardous is cytotoxic drugs. Parenteral nutritions or parenteral preparation, injections, intravenous infusions, powder for injection, and also implants will not be supplied using unidose system. For all these things, we will use a flow stock system and also other method of drug delivering system. Just to show you all how the drug will be supplied to the patient in the ward by using a bin. I'll let you know what is the drug bin and everything later, but just for you to know now, here's a patient was given potassium chloride and at 2 p.m. So the time is stated there in the drug bin. We just have to take the medicine at 2 o'clock and give to the patient. This picture actually shows this. The drug is given 4 times daily. Potassium chloride is given 4 times daily. So for each compartment representing the time of drug is being administered to the patient. It's easy for us to give this to the ward, and the nurses will take the drug at exact time and give to the patient. Now that you all know what is the definition of unidose system, the characteristic of unidose system, and what are the drug can be given by using this system and what are the drug cannot be given in unidose system, I'm going to tell you what are the advantages of this unidose system as compared to the system that I told earlier. First of all, there's a less medication error by using or reduction of medication error by using a unidose system. There will be also decrease in the total cost of medication related activities and more efficient use of pharmacy and nursing personnel, because we can see that a lot of people or pharmacists will be involved in in supplying the medicine, and of course there are other processes that are involved in unidose system. I will go into tell you later. There will be more accurate patient billing for medicines, for example for the private hospitals, and minimization of credit for drugs. This is also applied for the the private hospitals. There will be improved or greater control by pharmacists over work pattern and also scheduling. There is also improved drug control and drug use monitoring by the pharmacy side when we use unidose system. And there is a reduced non-nursing cost for the nurses. They don't have to pack the drug and give the drug. It's all being done by the pharmacists, right? And there will be a reduction of inventories maintained on nursing unit. So all the drugs will be kept in the pharmacy department. Only drug that is floor stock items will be kept in nursing units. Not only is the unit dose less expensive and safer for the patient when considering its entire impact on medication distribution and also patient safety, but it placed the pharmacist in a better position to be involved in patient care. Now the pharmacist was receiving medications order and could intervene prior to the first dose being available for the nurses. Even though this was a new role for the pharmacist at that time, it was much better use of their knowledge and training, not just sitting in the basement or the pharmacy department and just supply the drug without looking at the patient or without even having a contact with the patient. So this unit dose system had a higher acceptance by the pharmacy staffs. We start to have closer tie with the nurses. We have to have good rapport with the nurses because we are supplying the drug with them, and it's considered as more patient-oriented rather than drug-oriented. Patient-oriented here is there is more engagement and interaction between the pharmacist and the patient rather than we are just talking to the drugs. Despite the advantages that I have told you earlier, there are also several disadvantages of unit dose system that we must be aware. The first and foremost important is the increased cost, especially for buying additional equipment to prepare the unit dose system. They have to buy a machine to do the labeling, packaging and everything. This is very time consuming because the drug is being supplied daily for patients and each drug will be placed in a different part of the drug bin or drug carts. It is labor intensive. We need a pharmacy assistant to do this work, and also pharmacists will be doing this work, and it will be very troublesome because there will be frequent ordering in the daily basis. Every day there are several patients coming into the hospital and also being discharged. Whenever they come to the hospital, we have to prepare a new unit dose, medication for the patient. But if they are discharged in for example in a half day, that we have to take the drug over and supply for the new patients. So it is very frequent ordering and also is very time consuming. Nevertheless, all these disadvantages is only minor things. We have to look at the positive side of unit dose system. These are some of the pictures of showing how the unit dose system are being kept in the hospital or in the satellite pharmacy. You can see here there are a lot of drugs being packed individually, and on the upper rack is the tablet preparation and also capsule preparation, and the second rack we can see here, the below one, we can see that these are the rack for packing of solution and also oral preparations. If you can see here the bird eye view of these drugs, you can see it's like a chocolates being arranged in the pharmacy department. This slide actually shows the liquid unit dose, the thing that I show you earlier. The example I show you is lactulose and also potassium chloride solution, right? Unit dose container for liquid can be seen here. There are two types. One is 10 ml and another one is 20 ml plastic bottles. Usually these containers or bottles will be labeled by their strength, milligram per ml, for better recognition of the drugs, and also the expiry date of the solution will be also labeled in the bottles. So far we have been learning about what is unit dose system. It is now time for us to know how to provide unit dose services in a hospital setting. There are two main ways that a pharmacy can be structured in order to provide unit dose services: the centralized and also the decentralized model. Now let us look what is a centralized model. It is a model emanates from the main pharmacy. This will be the centralized location. For example, in Hospital Pulau Pinang, there is a main pharmacy department in the first floor. The medication order is received in the central pharmacy, and all of the processing for the patient occurs there, including order processing, drug packaging, cart fill or bin, and also the medication dispensing. The advantages of this model are that all resources can be localized in one area and the drug inventory can be minimized. The biggest disadvantages is that the pharmacist is not able to directly interact with the physician and nurses. Clinical services are limited since the pharmacy is not closely located to the patient care area or near the wards. The decentralized model, on the other hand, is characterized by pharmacy satellites distributed evenly throughout the institution. It can be one satellite in one block in a big hospital. A physician order is routed to this satellite. The pharmacist there processes the order and dispenses the first dose of the medication directly to the nursing station. Since they are closely located to patient care areas, it is very easy for the healthcare professional to stop by to ask a question to the pharmacist. The pharmacist can also go into the patient care area to speak with a patient or provide clinical services. So we have more patient care services in this kind of setting. In addition to the pharmacy satellite, a centralized pharmacy still exists to provide card fill or bin fill and serve the decentralized satellites. Also, the central pharmacy remains open all the time, providing services for the satellites when they close. These satellites can be focused on pediatrics, oncology, critical care, and also the emergency room and the operating room. The advantages with a decentralized model compared to the centralized model includes reduced turnaround time, increased physician and nursing satisfaction, expansion of clinical services, fewer dispensing error, and also decreased flow stock. The personal responsibilities of the professional staffs have changed dramatically with the unit dose system. Many of the activities once performed by the nurses have been assumed by the pharmacy personnel. The pharmacists now from just becoming a simple recurring mechanical duties, they have transferred their duty to professional services, which are more responsibility for the hospital's complete medication order cycle. The pharmacy have now become highly visible member of the healthcare professional. As for the pharmacy technician, they have become the supporting personnel for the pharmacy department. They perform manipulative tasks as in-house packaging, setting up the pharmacy doses, and others. They have become a well-trained pharmacy technicians. Now the pharmacy can free much of the pharmacist's time for supervisory, educational, and clinical activities, which is more patient-centered. Just a quick recap of what we have learned so far. By now, all of you must be mastered and also know about the different types and characteristics of drug distribution system, mainly flow stock system, patient prescription, and also unit dose system. We have also learned about the advantages and also disadvantages of each of these systems, and also the ways to provide unit dose services, which are centralized model and also decentralized model. Hopefully it is useful. Thank you.